Optic nerve. Introduction. Optic nerve is the second cranial nerve. It is purely sensory and responsible for vision. Hence, it is also called nerve of sight, functional component. It contains special somatic afferent fibers, which carry sense of sight from the visual field of the corresponding eye. Course and relations. The fibers of optic nerve arises from ganglion cells, second-order neurons, in the neural layer of the retina of the eyeball, where it converges towards the optic disc at the posterior pole of the eyeball and pierces the outer wall of retina, choroid, and sclera to leave the eyeball. These fibers unite to form the optic nerve, which passes posteromedially through the posterior half of the orbit and enters the middle cranial fossa through the optic canal. In the middle cranial fossa, optic nerves of two sides unite to form the optic chiasma. Diverging from the chiasma are optic tracts. Most of the fibers of the optic tract relay in the lateral geniculate body. The third-order neurons arise in the lateral geniculate body, run in the retrolenticular part of the internal capsule, and form optic radiations. The fibers of optic radiations terminates in and around the calcarine sulcus of the occipital lobe, visual cortex. Thus, visual pathway consists of the following components in the craniocaudal order: retina, optic nerve, optic tract, lateral geniculate body, optic radiation, visual cortex. The optic nerve is 4 cm in length and is divided into 3 parts: intraorbital part, canalicular part, and intracranial part. It is enclosed by 3 meninges of the brain. The thick fibrous dural sheath of the optic nerve blends with the sclera of the eyeball. The subarachnoid space containing cerebrospinal fluid surrounds the optic nerve and is continuous with the subarachnoid space of the brain. Clinical anatomy. The compression of optic nerve results in optic atrophy, which subsequently leads to ipsilateral total blindness called enopia. Management. Clinical testing of optic nerve. The optic nerve is tested clinically by performing tests for visual acuity, color perception, and loss of vision in different visual fields. Surgical treatment. Endoscopic endonasal approach. It is done through the nose to operate on the areas at the front of the brain by a thin tube called endoscope, which is threaded through the nose and sinuses to remove the compression of optic nerve.